55th anniversary of MedicAlert. Blair Bigham is with us this morning, who's from the MedicAlert Foundation. Blair, good morning.
Good morning. Thanks for having me on.
Well, thank you. And with changes in technology over the last 55 years, the basic technology of the bracelet hasn't changed that much, but it still does a very valuable function, I guess, Blair.
Absolutely, yeah. At a time of need and an emergency, it's a quick and easy way of getting the information that we need to make the right decision for people.
Are there still people who need MedicAlert bracelets who aren't getting them for some reason?
I think so, yeah. I actually find in my practice as an emergency doctor, maybe only 1 in 10 people, and that's just a rough guess, of people who I think really should be wearing a bracelet that identifies their life-threatening condition actually wear one. Some of them have it at home but don't wear it, and other people haven't really thought to go out and get one.
Well, you have a lot of insight as an emergency doctor, and there's something called the 1-2-3 rule for an emergency, and I guess this applies to people who may be in some type of distress if you find one that has one of these bracelets. And how does this work, Blair?
Yeah, so it's a quick way of remembering sort of what to do when you're frazzled in an emergency. When you come across someone who really needs help, the first step is just to identify yourself and try to make them feel at ease. Next, call 911, call for some help, and get as much information about you as you can about the patient. These would be things like, are they breathing? Do they have a pulse? Do they require CPR? And certainly if you were trained in CPR, we would want you to start it right away and perhaps call for a defibrillator. And then the third step is to take a look for that MedicAlert bracelet and see if there's any other information there that you can gather. In most emergencies, the patient's not able to speak to us, so looking for that bracelet gives us data that we couldn't otherwise get.
And so you're very informed of this because not only are you a physician, you also work the other end as a paramedic too, I guess.
That's right, yeah. I spent the last 10 years working as a paramedic and then transitioned into the hospital.
Okay, well, thank you for what you have done and continue to do as well. I guess my other question this morning is the onus on the patient? Is the doctor the one who should be saying you need a MedicAlert bracelet? How should that be handled?
That's a great question. I think doctors have a really large role to play. All healthcare workers, nurses, paramedics, anyone who comes across a patient and goes, you know what, you've got a condition, and if you're not able to communicate that, it could really affect the outcome here. I think you better get a bracelet. But also, we're looking for families and friends of people who know that someone has a medical condition to maybe say, hey, have you considered getting one of these? It could save your life one day.
Good advice. Is there a website or somewhere where people can find out more, Blair?
Absolutely. MedicAlert.ca is a great resource to go and take a look at the service that MedicAlert offers. It's more than just a bracelet. By signing up for a MedicAlert service, you get a 24-hour hotline that emergency responders can call anytime and get all of your information right then and there. And I think that the greatest way that I've seen this work in my career was actually as a paramedic. We knew absolutely nothing about a patient having a stroke. When we called the MedicAlert number, they were able to get that patient's family on board, and by the time we got to the hospital, the family was walking through the door. They had no idea the stroke was going on, and we wouldn't have been able to get in touch with them had MedicAlert not been able to give them a call.
Wow, there's a great example right there. Yeah, we mentioned the technology of the bracelet hasn't changed that much, but once you make that call, the technology otherwise is just amazing these days, I guess.
Absolutely, yeah. The ability to get your information to the hospital or the paramedics that are taking care of you is almost instantaneous.
All right, well, some great life-saving advice this morning. Thank you, Blair.
Thanks very much.
Good
Have a
talking
great day.
to you. All right, great.